Well, thank you so much and a very good morning. My name is Jagen Asemakola Zikso. Welcome to BC TV once again on another very lovely day. Today is the fourth day of this month of May in this year 2022, and it is a Wednesday. Welcome and thank you so much for joining us. Now tonight we'll have Behind the Headlines, of course, with Charles Odongtho. They'll be discussing issues that are trending in the country. Just prepping you and letting you know that that's what will happen tonight at 10 o'clock. Charles Odongtho will be coming back with Behind the Headlines. Now let's complete our Good Morning Uganda segment, and we do it with the Good Morning Uganda Extra with myself, Jagen Asemakola Zikusoka, and of course joining me in studios two epidemiologists, Dr. Patience Mwine, an epidemiologist from the National Institute of Public Health and the Ministry of Health. You are very welcome, Dr. Mwine.
Thank you very much. I'm very glad to be here this morning with you, team.
Thank you very much. Together, Dr. Mwine is Ndugu Agrevia Ruhanga, another epidemiologist also from the Ministry of Health. You're also very welcome.
Thank you very much. Nice to be here. Good morning to you all viewers.
On a very light note, let me start with this. On Sunday, 1st of May was Labor Day. We celebrated it at Kololo, and your minister, my minister, our minister, Dr. Jenotha Chengochero, was given a medal. And my other very good friend of UVRI, Dr. Professor Pontiano Karebo.
Yes.
Just a message to them and the others. What message from you, Ndugu Ebiaruhanga?
Thank you very much, the presenter. Labor Day really was celebrated at Kororo, and as you have previously mentioned, medals were given, and this is under the umbrella of the Ministry of Health. Done a tremendous job to respond to different diseases in the country, and we are still on the right track to make sure that we curb down all the diseases that are in the population. Okay. We want a healthy population.
Very, very important. From you, Patience?
Yes, please. So we want to really applaud all the health sectors and all the people that participated, especially in the fight of COVID-19. It has been a very, very devastating disease that has capped the entire world and put it at stake. So we want to applaud the different stakeholders, especially the Ministry of Health, for the work that they did for all the people that were involved in the fight of COVID-19. Okay. And we want to also extend our thanks to the implementing partners that were actually there to support Ministry of Health. And we say thank you very much. And we continue to fight the work is ongoing, especially the fact that now we are on vaccination and we want to protect the public from the unknown coming or possibility of possible outbreaks that are on the way. So we want to say out to you that thank you very much, and thank you to the public for the response.
Very important. Now, in March 2020, of course, COVID came into this country. March, and index death was sometime in July. That same year, when we lost somebody in Namisindwa, in the eastern part of Uganda. Yes. And thereafter, of course, we kept counting numbers cumulatively of how many people have contracted this disease, and also the people that have succumbed to this disease. But the very fortunate bit about it is even when so many people contracted, but again, so many people recovered from the disease. Here is where we are today, back into an open economy, and life has gone back to normal. We are back in stadia, we back into cinemas, we back into churches, we back into bars, we back into the marketplace and everywhere. When we want to talk COVID today, who can listen to us when we are talking about COVID? Because in the minds of certain people is COVID came, it saw us, it went. And we even don't know where it went. Do we still have COVID amongst ourselves, Dr. Patience?
Yes, thank you very much for that very important question. We actually have COVID with us. Apparently, of course, we have had over 164,000 cases in Uganda. Those ones are actually the ones who accessed testing. We don't even know those ones who just recovered from home and they just treated themselves with herbs.
Could be about
we don't
80%.
know. Yeah, probably. And that explains the low numbers that we have in Uganda as vis-a-vis the other countries. And then, of course, the deaths we are that Uganda, some people died in homes especially during the second wave. So COVID-19 has had we have had 3 waves in Uganda. The first one, of course, was a bit low. We had very mild travelers and everyone. But of course, during December 2020, we saw a peak. And we found that the health sector, the health system was actually overwhelmed. And then all of a sudden we saw Delta. You know, after that Christmas, everyone went like the way we are now. No SOPs, everyone started doing business as usual. And then all of a sudden we were hit by Delta. It really devastated us. The hospitals were overwhelmed, people were dying. We lost so many health workers. And of course later we have our Omicron, everyone was calling it a Macron and everyone was excited about, but people were now becoming immune to COVID-19. But the issue is that even though Omicron was mild, this COVID-19 virus mutates or it keeps changing itself. So we are not sure what is happening right now, even though the third wave went down. We don't know what is happening. And that is what explains why we still have fewer cases in the country that are being reported. Therefore, the public needs to be aware that we still have COVID that is ongoing, and we have to be prepared for the future. We have to be prepared for the next phase. We are not so sure what is coming next, and that's why we are coming out here to talk about vaccination. Everyone needs to listen to COVID-19.
Thank you very much. Dr. Byaruhanga, you know, before the country was fully reopened, the president spoke to the nation. He kept guiding us and telling us what we need to do. And he said we are looking for a critical mass of, we started with 4.8 million Ugandans, then the numbers shot up to about 5.2, incorporating and including now the restaurant workers, etc. And of course there was a lot of this drive from different stakeholders saying, please, let's build the morale, let's build the momentum to get the required numbers, because we were looking at being opened. We wanted to get back to a normal. And of course, everybody was scampering, running to go and get vaccinated. Yes. When we opened up, we no longer see these queues in places of vaccination like we used to see it. We used to go for vaccination at Kololo, at KCCA, at different places, because we allowed to go to the market, patients are allowed to go to her salon, Jagend is allowed to drive his taxi. And the question is, why would anybody even want to go for a vaccination? Let's talk vaccination now.
Thank you very much, the presenter. As Dr. Patience has mentioned, really the COVID-19 affected us globally, but in Uganda also it really hit us. So based on different studies, we developed the vaccine, different vaccines, and they came into the country last year, 2021. So in early 2021, we started vaccinating the risk populations.
In actually March 2021.
March 2021. Then later around August, then we started what we call accelerated mass vaccination of all Ugandans. So we have had 2 rounds so far, where we are targeting all people in their communities. So what the ministry did was regionalization of this mass COVID campaign. So we would go to regions, go down to the parish levels. We get all the mobilizers at the village level. So we have been vaccinating people in their villages. That's why you are not seeing all of those lines at Kororo. So we have been going to villages, and we have really done a tremendous job in our villages, and the people have been vaccinated, quite a number, but we still think a sizable number are still there, and we want them to get vaccinated. As we are saying, the president opened the economy, so we want everyone, our target is to hit over 70% of the population.
What are we shot to as of now? You talk about 70%, but where are we?
So we're about the fully vaccinated.
Fully vaccinated.
We're about 24 26% about there. Okay. So we want everyone to get...
So fully vaccinated are those that have got both jabs?
Yes, both jabs.
For those that are supposed to be 2 jabs, except for Johnson & Johnson?
Yes, please.
Okay.
So we want to hit over 70%. That's what we call herd immunity. Okay. So if the population is almost fully vaccinated, then if one gets the disease, it is unable to spread very fast to other people.
Do we have vaccines in the country?
Yes.
Are they enough for us?
They are enough, and they are in our facilities. So when we did those 2 rounds of accelerated mass vaccination, we made sure that all the remaining vaccines are left at those different health facilities. And of course, to maintain our cold chain system, our vaccines are always at health facilities. So we just pick them, go to the community, vaccinate people, and take them back. Okay. So people should go and get vaccines. Let them go and get vaccinated. Okay. We have all the vaccines at different health facilities across the country.
Do all vaccines work the same? Because there's also an issue of vaccine hesitancy because of the nature of the types. In America, they're doing Moderna, then when they give us AZ, in the other part, they're doing this, and you know, there was that hesitancy of the vaccines. Do all the vaccines do the same thing? If I got this vaccine and she gets another vaccine, are we getting the same thing?
Thank you very much. You see, COVID really found us unaware, and there is a lot of science that has been going on. So when this vaccine came, of course, there were a lot of hearsay that in America we are using this, in the UK we are using this, but different studies have been conducted and have found that all vaccines, they are very safe, they are effective, they protect us. So whether you get Moderna, whether you get Johnson & Johnson, whether you get AstraZeneca, all the vaccines are safe. And they do the same thing. Thank you.
Okay, thank you very much, Mr. Byarhanga. Dr. Patience, address me on this particular one. Now, picking it up from where Ndugu Byarhanga leaves it, talk about the various types of vaccines. Now, you'll notice that you have about 24-25% of Ugandans who have received both vaccines and they are fully vaccinated. We're looking at a critical mass of 70%, and we still have a shortfall of that number. But you also notice, I don't have the stats or the figures with me readily, of how many people have received 1 dose, but you'll find that those are actually very many. And the challenge is, there are many who received 1 dose and they went to KCCA and maybe received Pfizer. When the economy was opened, they went complacent. They fell into some laxity somewhere, and they're saying, after all, the economy is open. And even here, we do not have we do not even have more, or we don't have any COVID patients in any of our facilities. So I'm only thinking there's even no COVID. Why should I go for the second one? What is the fate of those who received 1 jab and they have forgotten about another jab?
Thank you very much for that very important question. What we would want to say is that even though you received your jab, the first one, and probably you forgot to go, it is very important for you to go for the second shot. It does not mean that your immunity is compromised completely, or the first jab is not working, but it's just that the first jab that you received is not very effective. Therefore, if you go for another jab, you will actually be more protected. So we encourage you, even though you hid your card and you don't even remember, go to the facility and get your second shot. Yes, so that you're boosted, your immunity is boosted. How
effective would the second one be, especially after a very long period of time? I'm looking at somebody, let me just give you a scenario that I belonged to. At my church in Deva, we organized a campaign to vaccinate people. We worked closely with KCCA, and we brought staff to our church in Deva, at Victor Christian Center. And for a whole week, from about 26th, 7th, 8th, 9th, 10th, first and think second, for a complete week. Now, people came and they were being administered with Pfizer. Now, from December, or from January 1st when we ended, to date, we've never done another. But of about, we vaccinated up to about 2,500 people, those who came, about 2,500 for the span of those days. And majority of those, about 80-90% of those, were actually coming to get their first dose. The mindset says, I will go back to church to get the second jab. maybe because I trust church, or maybe because church is nearer. Now remember where the church is. There are so many people doing different things, garages, people doing carpentry, and etc. Who will not walk to KCCA? They will not walk to Kololo or the Ministry of Health or anywhere, or Mulago. And they're thinking, if KCCA comes back again to Victor Christian Center Church here in Ndeba, then they will walk from the garage, come and get the second one. But the last one that we did was on the 2nd of January. It is 4th of May. Now, I'm looking at all these months, and I'm looking at a very lazy person who says, I will only go back where I got the first one. What happens to them? What about if we do not call back KCC at church until maybe December? What will happen to them?
Thank you very much. We understand that there are such people in our population. And of course, we are there to support them. And that is why we do such campaigns. That's why we come to the media and we talk to the public to come out. Even when you have received your vaccine, you need to go back to the facility and get your second jab. You're not fully vaccinated if you have received one. It is not effective. And you've heard about the third booster dose for those people who are at a higher risk. We are even talking about it that if you have only received only 2 and you're at a higher risk of getting severe COVID-19, for example, get a booster, the third dose. So that you're more protected. So that is why we come out. We know that they are there, even including ourselves, some health workers who forget. You need to go back and get vaccinated, your second jab. But we say that even though, our bodies work like they get memory cells. So even if you got your first jab, yes, your body got memory that probably there is COVID. And it produced some antibodies, you get. That's why they do not die out, though the immunity goes a bit lower, it reduces as time goes on. So that's why even though you got the first jab and you forgot, you need to go back so that you remind the body that COVID-19 is actually still there, you can still get it. So it is not about that if I forgot, I need to maybe vaccinate them or not really.
Ndugu Byaranga,
yes,
you wanted to
have
chip in something.
Thank you very much, Ndugu Presenter. In addition to what Dr. Patient has said, I already mentioned it, that in our accelerated mass vaccination, we are using a parish model where we identified all the villages across the country. In each village, we are using 10 mobilizers. Those
about 68,000 villages in the country.
Yes, we had them. We had them. And they would go in each village, household by household, to mobilize people to come and get vaccinated at different designated sites. And these were mobile vaccination sites. So today we are at Ndeba Church. The following day we are at that junction, maybe going to Entebbe. Chibuye. To make sure that at least we reach everyone in the community. So we based on the information from our mobilizers, we are the village health teams and chairpersons. So that's why maybe you don't see people coming to church when there are very many that they are looking for vaccines. What I know is that most of them are already vaccinated based on the approach we used. Thank you.
Very important. Now, both of you, help me again attempt this. You're the epidemiologists, you're the experts. I am only a talker on TV.
Not really.
I don't know much about what you do. But because we have various and different types of vaccines, save for J&J, which is a one dose. I saw that I escorted Minister Katumba Bala to Kalangala to give the people there, because those move with the tides. When the fish moves and relocates, they also move from one island to another island. So those were getting actually one dose, and to them, they are safe and secure like that. How about for those who received AZ at first? You go to a facility and it is AZ here. I have no choice. She vaccinates me with AZ. Now, when I go for the second dose after a period of time, and now it is not AZ in stock, it is Moderna, it is Pfizer, it is another one. What happens? Do I Now, there are not so many people who are like me, who will ask all these questions. Some people will just come and say, here is my card. They even do not know whether it was Pfizer or anything, because they even can't read whether it's Pfizer or it's anything. And they just come. So what happens if I received AZ? Can I get a Pfizer? Or if I received Pfizer, can I get, or if I do not find what I actually got ab initio, what happens if I can't find that same one anywhere? I'll start with you, Patience.
Thank you very much for that question. That is whereby one person gets the vaccine today, and then they want to go back and they find something different. We call it mix and match.
Mix and match.
Yes. Our studies have shown that actually people who receive different vaccines, different types of vaccines, they have better immunity compared to the person who has received one type. Therefore, we want to say that it is very safe and it is okay. Health workers have been trained and they know how to do the mix and matching. So, for example, all you need is to just go with your card, vaccination card, to the health facility where even if you go to any health facility, whether you received the vaccine or not, as long as they are giving the vaccine, already it has information of which vaccine you received at first. You'll be given another vaccine. It is very safe and you shouldn't worry about it. Okay. Yes.
You shouldn't worry?
Yes, you should not worry, and more to that is that you will get better immunity than someone who received one type of vaccine. For example, most health workers got AstraZeneca because that's what was available.
That's what we had.
And I can say that people are at a better opportunity because now we have a variety of choices to choose from. So most like these people who have received two vaccines are much at a better advantage compared to people who received one vaccine. And that's what research says.
Okay, and I think she's explained that. Ndugu Byaruhanga, talk about eligibility. Because when we're starting, we demarcated people, say the frontline workers, we want this many people, and of course we counted the figures of 4.8 million to maybe 5.2 million, just about, but of course it now became all of us. But even where we are now, let's talk eligibility over who should get vaccinated. Should all of us go and get vaccinated, or there are certain age groups that are exempted from the vaccination?
Okay, thank you very much once again. Currently, we are vaccinating everyone who is above 18 years for all of the vaccines, except any child who has, we call them underlying conditions, comorbidities, diabetes, hypertension, they can get Pfizer. Okay. And we have been giving it out through the other accelerated mass vaccination. So I implore everyone above 18 years who has not received either the second dose to go to the nearby health facility. The vaccines are there, it is for free, they will vaccinate them. So research is still going on, and we have a plan to vaccinate also all the children below 5 years, but in the country we have not started that. But in the near future, I think also we shall get to them and vaccinate them.
Okay.
Yeah, thank you.
Now, the other very important thing here is, do I catch COVID after being vaccinated? Because as somebody will say, why am I putting on a mask? Why should I even... Why am I putting on a mask? Why am I putting on a mask if I received my 2 jabs?
Yes.
And my neighbor received, or even all of us received. Now we are all health workers, and we all received. We are in an environment where we're all vaccinated.
Yes.
Why should we even continue putting on a mask? Why should we continue doing these observing SOPs?
Yes.
Because the mindset says the vaccine is actually
effective.
A protection against me catching COVID-19.
Yes.
Does somebody catch COVID-19 even after receiving 2 doses? Dr. Mwine, you're laughing at me.
Because you're not wearing a mask even now. Thank you very much. But actually...
amazingly, every day I'm putting on a mask when I'm in studios.
Except when we are discussing COVID.
No, but because both of you came and you're putting on a mask, I said, okay, they will not allow to remove their...
You're still protected.
Okay. Thank you very much for that important question. To our viewers, we would want to say that even when you're fully vaccinated, you can still get COVID. The importance of COVID-19 vaccination is to protect you from severe disease and death. What we can assure you is that as long as you're vaccinated, you may not get into oxygen, you may not get on to the extent of being, dying, let me say it like that. So that is why, even when you're fully vaccinated, because you can transmit you can actually pass on the virus, you should maintain SOPs even you're fully vaccinated. You will actually get the virus. For example, I was fully vaccinated, but I got Omicron. I had a test.
The third wave.
The third wave. I got Omicron. Even when I didn't have any of the other 2 waves, I didn't get any infection. So what am I trying to say? You can get the virus, but you will be protected from severe disease. That is the most important thing of it all. Then the other thing is that you should also still maintain the SOPs. When you're coughing, don't go in the public without a mask, or you start spreading the virus because you are not even sure what it is. So it is very important that even when you're vaccinated, maintain the SOPs, wear your mask, social distance in public, don't just go anywhere so that you're able to protect yourself from the disease and also transmitting it to the rest.
Okay, Biaruhanga wanted to say something on that maybe?
Yeah, generally, I think she has really answered it. You see, these vaccines, as she said, it gives you a protection to a particular limit. We can say maybe about 90%.
Okay.
So the remaining 10%, we say, can we still continue with the standard operating procedures, even for other vaccine preventable diseases? That is the message we give out as health workers. So every time we are vaccinating, we tell them, so we are giving you this vaccine to protect you. But in addition to this vaccine, add A, B, C, D. So to make sure that we can suppress the infection or the disease within the population.
When we had just started vaccinations in March 2021, April, May, thereabout, June, we had issues of side effects, clots, nausea, and quite a number of things that everyone was getting, and this was also scaring people away. And you know, everybody saying, you know, when they do this to me, we actually had some people who died because they had COVID-19, but they wanted to attribute it to the vaccine. It actually say, I was okay until I got the vaccine, and that's how I even died. You remember when we lost the Archbishop, Dr. Cyprian Kizito, they had even started alleging that because he received the vaccine, that's why he actually died, until his doctor, Sekabira, came out to say, no. The man died of a different thing, and actually at the time of his death, he hadn't even yet vaccinated. Side effects. And what should somebody do? And are these things still even there for the various vaccines? How should somebody manage side effects? What are the side effects? How severe are they? And what should somebody do to manage the side effects? Biaruhanga, before Mwine comes in.
Okay, thank you very much for that question. It's really a very important question. That all vaccines, apart from even the COVID-19 vaccine, they give what we call mild effects. Headache, can be fevers, okay, and a small swelling around the injection site. So we normally tell all of these people who have come for vaccination, or our children, you are likely to experience this, but be calm, it will go. Maybe if it has gone out of hand, fevers have persisted maybe for more than 2 days, we normally say go to a nearby health facility and seek medical care. So what has been happening for COVID, we have, we call it a surveillance system. And we are preaching to everyone who is getting vaccinated. The moment you feel any get any side effect, report to the health facility. And according to our system, we have not reported any really serious events out of this vaccine. So through the experience, but they are minor. And after 2 days, they go off, and the person becomes okay.
Okay. You want to say something on that?
Yeah, maybe to just add on what Agri has just said, is to say, is to tell the public that actually when you get the side effects, you're waking up the body. For us, we know that the vaccine is working. If I give you the vaccine and you get a fever, then that means you're getting your immunity is waking up, because that is the only way it triggers the reaction. So you should not get worried about it. For those people that may experience severe side effects, we are aware of them. You need to just go to the health facility. Though sometimes people may attribute it to the vaccine when it's not. So it's very important, go for an assessment and they assess you. There is a task force that is responsible for that. If you go, they usually report to the national center and then you are managed appropriately. So you shouldn't really get scared about the vaccination.
Both of you be very honest to us. We are supposed to die after 2 years of vaccination. Please just help us understand this. The naysayers and those, the riders say, when you receive a vaccine, this thing kills you slowly, and after 2 years, every one of us who received the vaccine is supposed to die. Should we prepare to die after 2 years?
You want to answer?
It's okay. As I said, when this COVID came, it came with a lot of stories across the board. But you remember that we have been having vaccines, okay? We have been vaccinating people way back.
Hepatitis
B, chickenpox, smallpox, measles. So
yellow fever. I was actually vaccinated by force at the airport
have people died?
In Nairobi.
Yeah, so have people died?
No.
So we got vaccinated when we were still young. Okay? So we are in the 40s, 50s, and we are still alive. Each vaccine, whenever it gets out to the population, it goes through a series of checks for effectiveness and efficaciousness. So all the vaccines for COVID now particularly, we are tested and went through all of those. WHO technical people sat and tested the vaccine. Even when it reached here in the country, National Drugs Authority, that is its mandate to make sure that the vaccine is safe before it is given to the population. So it's not true that we are going to die. We know the population is protected. Let's just combine our efforts of vaccination among other SOPs. We just prevent this COVID from hitting us again.
To both of you, finally, as we end, I want you to end on a note of assuring us where the vaccines are, how somebody can actually access them, and give morale give morale to the campaign. But you know, when I go for a driving test and I am looking for a driving permit, which I get to present that I did a driving test and I have this. When I sit an exam, I expect a transcript at the end of the day to actually present, to actually show. When I do any exercise, there's something for me to show that I was even actually baptized. Even when I go to church to marry, I have a certificate to present and show that I married her, and this is our certificate. What happens to vaccination, and where are these? Because at the end of the day, you know, for people, some people do not really care. Now, they only get problems when they are maybe traveling, and that's when they remember, I need to have a vaccination certificate or so. Now, you had something called EpiVac, I think, on the website, where somebody could actually go, put in their details, and maybe even have it or print it or even present it and show it somewhere. And I don't think the EpiVac still works anywhere anyhow. You're from the Ministry of Health. Please take back this response to them. And we just need to know, apart from I just coming to inject me, but what is this document that I will work with forever to present it anywhere to show that I actually got vaccinated?
Thank you very much. To the public, it is very important that if you get vaccinated, you must have a card. At first, we know we had limitations whereby people would go to the sites, they get vaccinated, but you never had a card. Cards were very few in the country. But we know that we have registers at these facilities, and all your details are recorded, including your NINI number. So this information is actually at the facility. So what we encourage you to do, if you don't have a vaccination card, go to your health facility where you got the vaccination from, let that information be fed into the system, where you mentioned of epivac.health.go.ug. That is the website where all the information for COVID-19 vaccination is being reported. And we also encourage the public, check your name, check your details. If that information is not there, go to the facility with your card, because we know this system came a bit later. Okay. Compared to what was there. So it is possible that someone could be entering information and maybe they jump your name because they are getting it from the register into the system. It is possible for someone to miss out a name. Please check. If it is not there, go to your facility, let that information be updated. And of course, we know that this system was brought up because people would make cards from downtown here, NASA, yes. Yeah, so
yes. it's and Epivac was actually solving that.
Yes.
If you get a card on NASA Road, then you won't be on the system of Epivac.
Exactly.
Yet when you go to the health facility and your details is taken from you, then it just gets into the Epivac.
Yes.
And it authenticates that wherever I am, I can actually just onto Epivac, put in my last digits of my telephone number or my NIN number. Then the next thing is, it shows the detail that I received Pfizer, the first dose and the second dose at this facility.
Exactly.
Yeah, so in addition to what she has said.
As we conclude.
Yes. Dear viewers, we are still in the COVID campaign. And this virus is still with us. As Dr. Patient has said, it is just sleeping. It can change anytime, any day, and hit us again. Let us get vaccinated, because vaccines internationally has been proved to be against all these infectious diseases. So let's all of us get vaccinated. Let us go to health facilities. Let them enter all our information. In case we want these certificates, we can easily access them through Epivac. In case of any problem, just go back to where you got vaccinated from. They will retrieve it and you will get your certificate. Thank you.
Okay. Final message from you, Dr. Patience Mwine, on vaccination, just before you get out of studios.
Thank you very much, our viewers, for listening to us and for hosting us. Thank you very much. I would just to extend my message of getting vaccinated out there. Make sure you are protected. Make sure it is the best time to actually get vaccinated, because we don't know the future. Secondly, we are in the Christmas period of where the vaccine is probably sleeping. Everyone is still thinking that COVID went away. COVID is still with us, and it is likely to mutate or to change itself and maybe cause another another wave. But if we are fully vaccinated and you're protected, you will not die. You will not get severe disease. The hospitals will not break down. We will not lack oxygen. So it is your responsibility as a public to make sure you're vaccinated as long as you're above 18 years of age. For those with comorbidities, pressure, diabetes, please go for a booster dose. It is highly encouraged so that you are protected from severe disease. Thank you very much. May God bless you.
Well, thank you very much, Dr. Patience Mwine, an epidemiologist from the National Institute of Public Health at the Ministry of Health. Thank you so much, together with Ndugu Agri Byaruhanga, also an epidemiologist. And of course, at 23.456% of those who are fully vaccinated, and we need to raise the critical mass to 70%. So it means if you got your first jab and haven't received the second one, please go get it. And if you've not received one at least, please go and just start it there, and of course get the second one. If you're lucky to get Johnson & Johnson, then you get it once and you add on to the numbers that we're looking for. Now remember, the campaign is to get herd immunity for our communities, but to just remind you that COVID is still with us and people still suffer from COVID-19. Now I normally attend events where the president is, and we are subjected to mandatory tests, and it's amazing waiting to actually go for a test and somebody tests positive, that's when you tell that COVID is actually still with us. And we can only know that COVID is with us because we have tested to know the status. But let's go get vaccinated to build a herd immunity community that we are all looking for. We'll stop it here for tonight. My name is Jagenda Semakula Ziksoka. Just wishing you all the best for today. We'll return tomorrow. God bless you. Shalom.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
It's no secret that ICT makes learning easy.
The strides made in our field could be possible.